Now it's time for us to have a conversation regarding health, and today the focus is on rickets, though of course the general subject is bone disorders, and to do justice to that is Dr. Bababjide Lawson. Great to have you on the show. Now he is the lead consultant, orthopedic and trauma surgeon, Reddington Hospital, Lagos. Great to have you on the show.
Thank you for having me.
All right, so Dr. Lawson, when we talk about rickets, most people don't quite know what it is. Could you please define it for us?
Okay. It's a disorder of bone.
Okay.
Now, you know, bone has the way it is structured. So, simple analogy is take a concrete block.
Okay.
So it has cement and sand.
Yes.
So in rickets, there's not enough cement in your block.
Oh, wow. So there's enough sand, there's everything, but the cement to hold it together isn't enough.
Isn't enough.
Oh, wow.
And that cement is calcium.
Wow.
So if that cement is not there, then the block, so just think of everything that will happen with the cement, with the block.
Yeah.
It will be weak.
Yeah.
It won't be able to take a building. Anything that puts on it will collapse. Just exactly that.
That's actually a fantastic way of describing it. But then what causes it? What causes rickets?
Okay. To answer that, let me tell you a little about how the body processes calcium. So essentially, you need vitamin D, and you get that from sunlight and also diet. So the body gets the information, sends to the intestines to absorb calcium, and then also sends information to the bone to say, okay, there's cement for you, make proper cement, good strength. So the problem with rickets is that anything that affects how the body acquires calcium and the process of incorporating the calcium into bone can result in rickets.
Wow.
And the commonest type is the nutritional type.
Wow. So there are other types. What other types are there?
Okay, so now let's dial back again. There are people that are born with an inability to process this. So we'd say there's genetic rickets, which is not very common. And then there are people, or usually, I mean, rickets is in children because it's a disease of growing bone.
Okay.
So in adults, there's a component similar to that, but that's not for today.
Okay.
So any disease that will now affect the body's capacity to absorb calcium, any disease that affects the body's ability to make vitamin D, that is, diseases involving the liver or the kidney, can also result in rickets.
Wow, wow. So how is it treated then?
Treatment, so let's restrict ourselves for now to the nutritional type, which is the commonest type.
Okay.
And so the first thing is, before you start treatment, you need to establish that, yes, this child has rickets.
Okay.
And the usual thing there is the manifestation is they usually have a very prominent forehead.
Oh, okay.
Not forehead gang, but prominent forehead.
I understand.
You know, wide wrists. And
wide?
Wrists.
Wrists. Wow.
Yes.
Okay. Prominent forehead, wide wrists.
Wide wrists.
Okay.
The legs tend to now have deformities, either very excessive bowing, excessive bow legs, or excessive knock knees, or what we call a windswept deformity, in which one leg is bow, one leg is gay. So it's as if the wind is trying to blow the legs away.
But
so it's like this.
Being bow-legged doesn't equal to rickets, does it?
No, it doesn't.
It doesn't. So, but this is just a way to define what it looks like and all. Okay.
So now, then, once the child shows those features, you start to suspect that, okay, this child may have rickets. At which point you now run tests to look for the vitamin D, calcium, to be certain that truly you have evidence to establish that this child has rickets. Okay. So once you've established that, the next thing would be to now decide on the treatment. Okay. Now, one of the other things that I failed to mention is that children that are kept indoors.
Uh-oh.
Yes. So if you're indoors...
As Yorubas will say, I'm going to get inside.
So once you're indoors, not enough sunlight, And if the child is very picky about what he eats, then there's a likelihood you may not get
enough calcium.
Not vitamin D and enough calcium by.
Okay.
So the treatment now would address those three aspects.
Okay.
One, you want to replace
the vitamin D, so like
D,
supplements. Good.
And you need to give at a higher dose to compensate for what is lacking.
Okay. Okay.
The second thing is to now establish a nutritional regimen.
Okay.
For the child and the parents to say, okay, please ensure that the child eats healthy. And things like eggs, fish, veggies are very, very important for vitamin D as well as calcium. Then for children, there are lots of, when you want to buy cereals, milk, you should try and look for the ones that are fortified with vitamin D and calcium.
Okay.
So that way you can ensure that, yes, the child is getting it. So that's the dietary portion. And then the other part is encourage the child to go out and play, get some sunlight. Anything between 11 and 2 p.m. Usually should suffice. And you need maybe anything from about 20 minutes to about an hour. Although the jury is still out about that, but that should suffice.
That should suffice. Okay, I have so many questions to ask you. However, I'm just going to ask you this last one before we leave. Is it preventable, though?
The nutritional one, yes.
Okay.
So essentially, make sure the child is eating foods rich in vitamin D and calcium. Let the child go out and play, get enough sunlight, milk, and all these other things. Just keep an eye on the child. One other sign that shows in rickets is that the child tends to be lethargic, disinterested in the environment.
Okay.
So when that is noticed, you try and get help on time. Pay attention to what the child eats.
Fantastic. Thank you so much for your time, Dr. Lawson.
Thank you.
It's been a very wonderful and eye-opening conversation.
Thank you very much.
It just begs to say that it's important to include vitamin D and calcium in not even just your children's diet, but in yours as well, especially when pregnant.
Exactly.
Yeah. Thank you so much for your time.
Thank you for having me.
Okay, with that, we'll take a break. Of course, Wake Up Nigeria continues in a bit. Stay with us.